Christy Hernandez. I work in human resources, learning and organizational development, and I'm here with my colleague, Melissa. And Melissa, I'm going to turn it over to you to introduce yourself and your colleagues who will be taking us through the session today.
Sure. So I'm Melissa Zohoric. I manage the benefits here for the city and county. I know I have one of my teammates, Angela Pearson, on the call, but I don't think Hannah Augustine, who you also may have talked to, is here. Kelsey Shirk from Hub International is also with us. And then I've got our special guest speaker who I do want to put in a plug. She will be here in person in March. I don't have the date right in front of me. So we will have another one, but it'll be in person. You'll be able to meet her and talk to her there as well. But it is Tiffany Stalder, and I am just going to let her take it away on this very confusing subject of Medicare.
Well, wonderful. Thank you guys so much for the introduction. So my name is Tiffany Stalder. I was a former teacher, so I am going to do my best today to be very educational about this Medicare topic because, yes, many people associate Medicare with being confusing. They know it's an insurance. They know there's options, but another word I a lot of times see is possible penalties. So there's a lot of scare tactics used around this Medicare market. And the goal of today with this Medicare 101 is to really make Medicare less scary for all of you, okay? Whether you're navigating it for yourself in the future or even for parents, we really want to make it less scary. Okay, let's move it here. So on a high level, what are we going to discuss today? I'm going to try to define Medicare and its parts. So, what does the A, B, C, D of the Medicare soup mean? What are your different enrollment options in the Medicare area? Again, a lot of times people think if you don't enroll in Medicare, there may be penalties. We're going to clarify some of that today. How will you pay for healthcare when you retire or when you leave your group plan? We're used to our health insurance just magically coming out of our paycheck every month. So what happens when that payment is in your control? How do you navigate that? And then finally, just helping you to transition from that employee coverage to Medicare when the time is right for you. That's kind of my goal, is to help you customize those options. Now, we will have a few kind of pop quizzes along the way, not to really score anything, but just to make sure they're kind of a good way of me to check knowledge, to see how everyone is doing, okay? So one of the things I think of when I think of Medicare is a maze. It feels like a maze that you could very easily get lost in. And probably one of the most complicated parts about my job is that as I'm helping you, I really have to get to know you as a person. That's actually a benefit. I love that part. But there is no one way through this maze, okay? It's not a one size fits all. As a lot of people said, there are options. There's different ways you can navigate it. So every time I meet a person, we are figuring out their own way through the maze to make sure they have the customized coverage that they can afford and that they deserve. But often when you're doing it or you're trying to navigate it on your own, this is how people feel, is like, oh, hello, is anybody there? I feel a little lost. All right, so we're going to start our way through that maze together. I do like to define Medicare and talk just a little bit about how it is different than Medicaid. So Medicare is your federal health insurance program, and it was originally designed for those who are 65 and older, and other individuals could qualify earlier than the age of 65 if they have a certain medical condition or a disability. So end-stage renal kidney failure, a chronic diagnosis of some sort that has led to you being disabled. Those all are reasons why you could maybe qualify for Medicare earlier than 65. But for the rest of us, we're going to have to wait for the first of the month we turn 65 to be Medicare eligible. Now, it's often used interchangeably with Medicaid. Medicaid is actually a federal and state health program. They work cooperatively for more people with limited financial resources. So where Medicare looks at age and then possibly disability, Medicaid is more focused on your financials, okay? Are you at the poverty level or below poverty level? And that does vary by state. The way I keep them separate in my head is Medicare is the actual health care being provided, where Medicaid is financial aid to receive health care. Okay, so that's just one little difference. I'm going to be focusing more on the Medicare component today. Quick history lesson on Medicare. It was created to help pay medical bills. It was started in 1965 and it is run by CMS. What does CMS stand for? Well, it's the Centers of Medicare and Medicaid Services. So now you know why people get them confused. That is under the Department of Health and Human Services. And again, it's mostly for people 65 and older. But some things have changed since 1965 because in 1965, believe it or not, 65 was considered old, right? Well, 65 now in 2025, you're not old anymore at 65, you're barely seasoned. I mean, average life expectancy is 83 to 85 years old. So we're planning for another 20 years of life. So the Medicare system had to change over time to start adapting to the population it's now serving. One of the first major changes was the Medicare Modernization Act of 2003. Before this, there was really hospital and medical coverage provided by Medicare. Okay, that was it. You had to get related insurance to get any other type of coverage. Well, the Medicare Modernization Act added in 2 extra letters, Part C, Advantage plans, your ability to go with a private insurance company that would give you hospital and medical coverage. And then they also layered on Part D, prescription drug plans, your ability to get a standalone plan just to help with your medications. Those 2 parts of Medicare, C and D, can be reshopped out every year because they're offered by private insurance companies that are simply contracted with Medicare. So you do have the ability to change that aspect of your care each year. Then the Affordable Care Act of 2010 that was put on by Obamacare, or some people know it as marketplace coverage. But basically, this Affordable Care Act made sure to add preventive benefits to Medicare that weren't previously there. Medicare was originally designed just to help you when you were sick or dying, but the Affordable Care Act actually put in some preventive provisions so that Medicare could continue to see you and screen you when you were healthy. And then finally, the Inflation Reduction Act. This was actually very, very recent in 2022, and they just phased in all 3 aspects of it in 2025. It took a couple of years to get done. But the Inflation Reduction Act really focused on how medications were covered under Medicare. Whether you were getting them through an Advantage plan or a Part D drug plan, it put things in place like a cap on insulins. It removed the infamous donut hole, and we'll talk about that later, but it was a point in your prescriptions where they could actually get more expensive later in the year, and it was very, very confusing. And they established a max out-of-pocket limit on your drug coverage that didn't previously exist. All great changes. So for more information, people will tell you, well, you can go to your Medicare and You booklet. Well, here's what I'm going to tell you. It's about 150 pages. And you don't get that Medicare and You booklet until after you have applied for Medicare. So what happens if you want to know about Medicare before applying? Well, you do the smart thing and you come to a seminar just like you did today. Then the other document that any agent can supply to you is what's called a Choosing a Medigap Policy Guidebook. If you've ever heard the words Medicare Supplement or Medigap Policy, these are the same things. It's like saying house versus home, but this is a guidebook that really tells you how is a Medicare supplement different than a Med Advantage plan? What are some things you should know when you're shopping for these plans? This would be something I'd be happy to provide for you, and we'll kind of go over the Cliff's Notes versions to make sure we're picking out pages that are suitable to your situation.
Tiffany, we have a question. We have a question in chat. Do you mind if I read it to you?
Actually, I did see that question. I'm going to get to that one. So
Okay.
I'm going to keep going through. And then I'm going to, because there's not a simple answer to that question. So it's going to take a little bit to answer that one, but I love
Sorry,
it.
I kind of gave the basic answer.
Correct. Yes.
So go ahead.
If it's this, if it's with the city of health insurance, but yes, we're going to get all into A, B, the enrollment and who pays first and all of that in just a bit. All right. So on a very high level, let's talk about the different parts of Medicare. So Part A is your hospital insurance, okay? And we're going to talk about the intricacies of that. Part B represents your medical insurance. Now, when those two are both enrolled, this is what people are referring to when they say original Medicare. Then we're going to skip the letter C for just a second and talk about that Part D. Part D is the one letter they got right. It's for prescription drug coverage. And again, it's a standalone policy with a private insurance company contracted with Medicare to provide prescription medication to you. Or you have these Part C Medicare Advantage plans, okay? Medicare Advantage plans can cover just hospital and medical, comparable to what original Medicare would have done. Some of them are also layer in drug coverage and extra benefits. Those are referred to as MAPDs, Medicare Advantage prescription drug plans. And then again, on a very high level, Part C is an or, not an add, but an or. And we're going to get down to the positives, the pros, and the cons of all of these, kind of the out of pocket you can expect as we navigate through this presentation. All right, so Part A benefits. For hospitalization, we need to think about inpatient. Often when I think of a hospital, I think of an ER visit or having surgery in a hospital. That is actually going to be under Part B. Part A deals exclusively once you've actually been admitted to the hospital as an inpatient, okay? You're so sick, you're so injured, you're spending, several nights in the hospital with the lovely gown and the peekaboo back. Once you're admitted to the hospital, before the government is going to start paying for that hospitalization, there is a deductible. And this year, that deductible is $1,736. Now, you might have noticed some weird wording here. It says you have a benefit period deductible. In health insurance, we typically are used to one deductible each calendar year. We meet that deductible, and then our insurance kicks in and does their thing. Technically, in the Medicare world, that benefit period deductible is a 60-day rolling window. So if I go into the hospital on January 1st and I spend 3 overnights and then I get discharged, but then I tried to make my husband a lovely Valentine's dinner and gave us both salmonella and I end up back in the hospital, right? Hopefully not. Back on February 14th, I'm within 60 days of when I was leaving the hospital and now I'm back in. I'm not going to have to pay that deductible again. But if 4th of July rolled around and I decided to do a fun party trick with a firecracker and it didn't end up so well, and I end up back in the hospital, well, now more than 60 days has gone on since I last left the hospital. Technically, that deductible has been reset and would be my responsibility again before the government paid. That figure is in bold because it is going to be adjusted each year by the government. Also, it is one of the areas that if you choose to get a Medigap or a Medicare supplement, that Medicare supplement can pay that deductible for you each and every time it occurs, or at least keep it to a one-time event. Other out-of-pocket areas we have to be aware of is if I manage to stay in the hospital for more than 60 days. Medicare goes, whew, you're starting to get expensive. We're going to back off on our coverage, and either you or that Medicare supplement are going to pay a daily copay for your hospitalization. For days 61 through 90, it's $434 a day. Days 91 through 150, it jumps up to $868 per day. And then after that, you get what's called these lifetime reserve days. Okay. Again, all of those bolded amounts are areas that a Medicare supplement is allowed to come in and pay to help keep your out-of-pocket affordable. In addition to your hospitalization, you also get access to skilled nursing facility care. Now, I don't know about you, but when I first read that, I thought they meant nursing homes. And I'm like, oh, great. Medicare is going to help pay for nursing homes. Unfortunately, it does not. Okay. What skilled nursing facility care is, it is an inpatient rehab. Think like your Madonna rehab facility there in Lincoln. Okay. I always say it's where you're well enough to leave the hospital, but you're not quite well enough to get home. I typically see this with a very, very bad car accident or most often a pretty major stroke. Well, you've got to meet Medicare's requirements for this to be helped with. The first is, did you stay in the hospital at least 3 days? And I actually think this should say overnights because the day of discharge does not count. So think 3 overnights. Did you enter that skilled facility within 30 days of leaving the hospital? To this point, I just tell people, don't be stubborn, okay? If they tell you you need inpatient rehab, let's go right away to make sure the government is going to help to pay for that care. And the third thing is that you need that skilled nursing facility care either 7 days a week or skilled therapy services at least 5 days a week. This is why you would be doing it on an inpatient basis versus an outpatient basis. When it's inpatient, Part A will help to pay. In fact, they'll pay 100% for your first 20 days of care. And then there would be a daily copay for days 21 through 100. It is important to know that after 100 days, Medicare is done paying for inpatient rehab. Now, that's not in a lifetime. That's after a discharge from a hospitalization. But again, I did mention Medicare does not pay for nursing homes or long-term care. Well, if you've been in inpatient rehab longer than 100 days and you're not well enough to get home, that's kind of what care you're looking for, is more of a long-term care situation. All of these bolded amounts are, again, an area that a supplement could come in and help with the out-of-pocket costs. All right, final part of Part A, we've got additional benefits in the area of blood benefits. If while you're an inpatient in the hospitalization or in the hospital, you get some type of blood transfusion or blood care, Medicare will pay after the first 3 pints. I always thought to myself, well, am I even going to live if I've lost more than 3 pints of blood? I did talk to some doctors. Apparently, yes, you can live after losing more than 3 pints of blood. But instead of BYOB to the hospital, okay, you can count on a Medicare supplement to come in and pay for those first 3 pints of blood. Home health care. These are benefits for medically necessary skilled care or medical supplies needed in the home following that hospitalization. And then finally, hospice. When we get to end of life and they are just trying to make us comfortable, benefits will be paid for any inpatient respite care, meaning am I in a hospital facility, or if I choose to have that hospice in my own home, they will help to pay for those related outpatient drugs to make me comfortable in my own home. This is a huge, huge benefit. I love that it's 100% paid under Medicare. In fact, when I coached this early on, I was talking to a farmer client of mine, and I said, Fred, isn't this amazing? The government cares that when you are dying, you don't want to be leaving behind bills for loved ones. And he said, Tiffany, it's because they know you're dying and you wouldn't pay the bill. But touche, Fred, right? Either way, I hope it gives everybody peace of mind to know that hospice will be very well covered. All right, so we've got our first pop quiz.
Okay.
Okay, go ahead.
I'm gonna launch
yeah.
this,
I like
and
it.
you can read through it, but I'm gonna go ahead and launch this as a quiz, and it should show up for everyone so they can select the answer and click submit. But go ahead, Tiffany, if you want to read through it.
Perfect. So which of the following would Medicare Part A not cover? Would it be inpatient rehab following a hospitalization? Would it be your blood benefits given while hospitalized? Would it be an emergency room services? Or would it be hospice care in your home? Let's see what you can remember.
Okay, so it looks like the majority of folks so far have answered emergency room services. Are you
Very
able to see
good.
those responses, Tiffany?
I didn't see the responses. I just saw that everybody took it. So love it. But for those of you who did answer emergency room services, you are correct. Okay. And then, yes, now at this time, and Melissa did answer it, but now that we've kind of talked about Part A, if you have employer coverage and Part A, majority of the time, the employer plan pays first. The only small caveat to this is if you happen to work for an employer that had less than 20 employees, then Medicare is required to be in the primary paying position. But City of Lincoln employees, obviously many, many more employees than 20. That's why Melissa correctly answered that the city's plan would pay first. Part A would be secondary. Good deal.
Okay, if that poll is still showing for you, you should be able to close it and get it out of your way so you can see the rest of Tiffany's presentation.
Perfect. So what about those emergency room services? That's going to lead us into Part B. All right, Part B, benefits. This is an aspect of Medicare that you need employer-provided coverage in order to delay. And again, that employer-provided coverage needs to be at an employer that has at least 20 employees. City of Lincoln qualifies. So what are the medical benefits provided by this other half of original Medicare? Well, they're going to cover what's called a welcome to Medicare visit. Doesn't that sound exciting? Basically, it's an appointment with any doctor or nurse practitioner of your choosing, and they're going to review the types of preventive benefits that Medicare will cover. They're going to ask you some memory questions, start talking to you about advanced directives so they can get a baseline of how you want to medically be treated in this fourth quarter of life. And the good news is, well, two pieces of good news. Number one, you keep your clothes on. And then number two, it's 100% paid for by Medicare. Okay. There's going to be other preventive services. Again, they're going to review that. But some of the typical ones I mentioned are like your annual mammogram for the ladies. Very common for the gentlemen is a PSA level blood work test to check and screen for prostate cancer. Okay. Breast cancer and prostate cancer, those are more likely the older we get. So there is screening once a year for that. A colonoscopy, the thing we all need to do, but none of us look forward to. Thankfully, on a purely preventive basis, they only want us to go once every 10 years. However, if a previous colonoscopy did find a polyp or a higher risk factor, Medicare will approve this on a more frequent basis. Medicare Part B is also going to cover any inpatient or outpatient doctor services. So whether that doctor checked in on you while you were in the hospital or just in their own office setting, any of those doctor bills are going to be filtered under Part B of Medicare. Surgical services and supplies, speech, physical, and it really should also include occupational therapy. Diagnostic tests. This could be an X-ray, a CAT scan, an MRI, a PET scan, anything like that. Durable medical equipment, whether it's a hospital bed, a wheelchair, a walker. Here's what I see more of: CPAP machines, diabetic testing supplies like glucose monitors, needles, testing strips. Also, if you've had a joint surgery and you need a sling, a knee brace, an icing machine, something like that, that your doctor is literally prescribed to you as a part of that post-surgical rehab, that would be billed to Part B. And ambulance services, whether it's vehicular or life flight, as long as it's an emergency or a medically necessary ambulance ride, Medicare Part B is going to help with that bill. Okay. Only other things I didn't really mention here, but I want to make sure is also treatments done in an outpatient setting, whether it's chemotherapy, radiation, dialysis, infusions or injections for osteoporosis, arthritis, things along those lines. When they're done in that hospital setting or that doctor's office setting, those would also be covered under these Part B benefits. So what's the deductible for Part B? Part B has an annual deductible. Love that word, annual, or words, annual deductible this time, because it means it's just once per calendar year. And this year it's $283, okay? So you are responsible for that first $283 of your medical expenses. And then Medicare is going to come in and pay 80% of any eligible charges, meaning is it medically necessary? Was it diagnostically necessary? Were you sick, injured, or showing symptoms? Medicare is going to pay 80%. You or a Medicare supplement would be left with the other 20%. Medicare is also going to cover 100% of any clinical laboratory services. Think about blood tests for diagnostic reasons. If they think you have a certain illness or they're testing for your medications, that actually gets paid 100% once you've met the deductible. There are varying amounts and various timelines associated with our preventive services. When you get your Medicare and You booklet, there will be a blue apple next to any preventive services. I say, apple a day keeps the doctor away. So that, and between your welcome to Medicare visit, they'll kind of review all of those with you. And then this fourth bullet here is super wordy. Nothing for any charges in the excess of the Medicare approved amount. It's referred to as a Part B excess charge. What does this even mean? It means if there is a holdout doctor out there that says, you know what, Medicare does not reimburse me enough. They don't pay me well enough. Therefore, I don't want to work with Medicare directly. Okay. However, the government did put in a safety net for you all and said, well, if you do end up seeing somebody who is on Medicare, you're only allowed to charge that Medicare individual 15% more than what we would have approved anyway. So if it would have typically been a $10,000 charge by the doctor, but Medicare only approved 1,000 of it, they could only charge you 1,150, not 15% of the 10,000. It'd be 15% of the 1,000. Okay. When we talk about your Medicare related insurance, it's important to discuss what Medicare related insurance would pay this Part B excess charge for you. On what plans may you have to pay it on your own? All right, another pop quiz to make sure nobody's sleeping, right? All right, so which of the following services, and this is going to pop up in the background here again, or in the forefront, I should say, which of the following services would not be paid for under Part B? Would it be doctor's office visits, a dental cleaning, an ER visit, or an outpatient surgery? What do we think?
Okay, so we've got the majority of people are responding dental cleaning.
Gosh, you guys are a smart audience, because I did mean to mention that while we were going through. I was going to say, hey, one of the doctors that doesn't typically bill Part B is a dentist, and I forgot to. But what you picked up on is I did discuss all of the rest of it, right? So just like your group insurance works at work, right? You have a major medical policy, and then usually you add a dental policy if you want that coverage. Same thing with original Medicare. Dental coverage is separate. Great job. All right, moving on to the next slide. Remember, we're going to skip C temporarily. It's not because I don't know my alphabet, but it really is an A, B, and D or C. So that's the order I talk about them in. All right, Part D. Part D is for drugs. This is where we hear really crazy language like, oh, well, you need credible coverage to delay this aspect of Medicare. What do they mean by credible coverage? It means, is your employer helping you to cover your prescriptions similar to or comparable to how Medicare would have helped you to cover those drugs? If your group insurance through an employer is considered credible coverage, you're allowed to delay this aspect of Medicare. So Part B is all about how big your employer is. Part D is all about, is your coverage good enough? Okay. Once you turn 65, typically an employer will send you a letter every year verifying if your plan is considered credible coverage. You want to hold on to those. All right, so what is Part D? Part D is a prescription drug option. Again, it's run by a private insurance company, but they had to contract and be approved by Medicare because they all had to meet a certain standard. Their goal is to help you cover the cost of your medications. Again, it's hoping to lower the cost of those medications over time and protect you against higher costs in the future. And these plans do vary by zip code and often state. Okay. One thing I tell people here is, though the government says Part D is optional, if you don't have credible coverage through an employer, if you were to delay Medicare and you didn't have that credible coverage, for every month you spent without Part D, later when you want it, you got to wait for an enrollment timeline, and they're going to give you a 1% penalty per month you went without the coverage. And that's a lifetime penalty. It never goes away. Yeeks, okay? Here's the good news. I've been doing this now for 11 years. Drug plan premiums, though they still vary. The cheapest one is $4.70. The most expensive one is a little about $140 a month. They have gotten, that lower price point has gotten cheaper over time, which is great. Also, this is that area that Inflation Reduction Act came in and said, well, you have to cover insulins as long as they're an insulin that you would have covered. We're going to cap an insulin at $35 a month. We're going to remove this donut hole when medications got more expensive, and instead you're going to have a max out-of-pocket limit. This year it's $2,100. So a lot of things coming into this Part D world. And then in the current state right now, though it has not been formalized, under Trump's administration, they are also looking at better inclusion and coverage over GLP-1s, weight loss medications that Part D drug plans did not typically cover, or would not cover without a diabetes diagnosis. Now they're looking at ways to also get those covered under your Part D drug plan. Okay. All right. Next pop quiz as it pops up on your screen. What are some of the recent changes made to these Part D drug plan coverages provided by the Medicare contracted plan? Sorry, you can read. Hopefully I bumbled that. The first one is the removal of the donut hole and max out-of-pocket limit for medications covered by the plan's formulary, basically the list of medications that are covered. That insulins are now capped at $35 monthly copays, and that plans must cover vaccines that are recommended by a doctor, or the last option, all of the above.
Tiffany, most people are saying all of the above. We still have some responses coming in, but yeah, it's majority all of the above.
Wonderful. And again, I think I might have mentioned at the beginning, but I forgot to reiterate it on this screen. Vaccines are now covered under either Part B or D, depending on how they're administered. But Part D used to not have to cover all vaccines. Things like Tdap vaccines, shingles vaccines used to not be covered by Medicare, and that has been recently adapted and now is covered. So great job. All right, we got some good listeners here. All right, so now let's talk about Part C, the Medicare Advantage plans, the OR. So once you're enrolled in a Medicare Advantage plan, you are removed from original Medicare's coverage, but you're still responsible for the associated premiums. And don't worry, we will talk about premiums here in a little bit. What does that mean? Well, it just means that the government is no longer directly paying your hospital and your medical charges. Instead, you elected that coverage through a private insurance company. Okay. Now, this is not a supplement. It doesn't work with the government. It works instead of the government. Now, to be contracted with Medicare and even be able to sell this type of a plan, they do have to prove that the plan they are offering you is comparable to what Medicare would have offered, meaning the deductible is similar, the copays and coinsurance are similar, and they're also going to establish a max out-of-pocket limit on those hospital and medical benefits. Normally, these do come with network restrictions, okay? It's a private insurance company, so it's all about who ABC Insurance Company or XYZ Insurance Company, what doctors do they have contracted agreements with, which hospitals do they have contracted agreements with, and those contracts can change throughout the year, but you are in the plan for a full calendar year. That's probably happened to everybody on a group insurance plan before, right? Where maybe the provider for your group insurance was haggling with some hospitals out there and some systems, and they may have fallen in or out of contract while you were under that hospital, while you were under that group plan. Same thing can happen with the Med Advantage plan. Now, why are these called Medicare Advantage plans? Typically, they do layer in your drug coverage, and then they also add in extra benefits in the areas of dental, vision, gym memberships. Those are kind of embedded in the plan at no extra cost to you. So instead of having to buy an extra dental policy, a gym membership, an extra vision plan, all of that's bundled into one so you can get your hospital, medical, all back into one card. It's important to note that just like original Medicare, your out-of-pocket costs can change over time. Each year, you have the right to reshop out this plan, but the deductibles, the copays, the coinsurance, the max out-of-pocket, the doctors, the networks, the pharmacies, they may all change. Now, these are the plans you see heavily advertised on TV, and they always end with, call this 1-800 number and give us your zip code to see if you would qualify for this coverage. Why is that? Because these plans are only offered in specific zip codes, counties within the state. So even Lincoln, Nebraska may have different options than Omaha, Nebraska. And where my aunt lived out in Gurley, Nebraska, which was a one-stop sign town near Sydney, they didn't have any MedAdvantage options. So depending on where you live within a state are going to be the amount of Medicare Advantage plans available to you. If I go from Nebraska and even jump over the river to Council Bluffs, completely different plan offerings, okay? They're very state-specific plans. It's also important to note that I cannot get a Medicare supplement or Medigap policy to cover my extra costs. Medicare supplements or Medigap policies are built to work with original Medicare only, where original Medicare pays as primary and the supplement pays as secondary. But if I switch over to an Advantage plan, this is my primary insurance. Original Medicare is no longer being built, which means a supplement cannot attach itself to that Advantage plan. Okay. All right, let's do a check-in here. Which statement is false about Medicare Advantage plans? A, you can purchase a Medicare supplement to help pay the out-of-pocket costs. B, these plans often include extra benefits like dental, vision, hearing, over-the-counter, and fitness memberships at no extra cost. C, plans can vary by zip code and county. And D, plans often have networks of doctors and hospitals. All right.
Okay, so the majority are selecting the first answer, the first response, A. We still have
Perfect.
some responses coming in.
Okay. All right. Pretty
Yep.
good response time now.
Yep, looks pretty good and mostly A.
Awesome. That is correct. Okay. It's kind of a double negative. It's correct. That is false. Yeah, you can't purchase that Medicare supplement to help pay out-of-pocket costs. There are other options like indemnity policies that you can do, but a Medicare supplement and a Medicare Advantage plan can never be co-owned. Okay. So where does my role come in? Okay. When I meet with an individual who needs to learn more about Medicare, either because they're about to turn 65, or maybe they worked past 65 and now they're looking at retirement and need to really start taking a closer look at this, here are all the things we're going to talk about because I need to know. Would you be better off under option 1, original Medicare, adding a drug plan and adding that supplement? Or, sorry, or is option 2 a better fit for you? That Medicare Advantage plan. So it's going to feel like I'm getting nosy, and I'm not getting nosy because I'm going to tell the insurance company anything about you. Why I'm getting nosy is to get a feel for you and what you're used to and what you're comfortable with. So we're going to compare it to your current coverage, right? We don't know the Medicare world, but you've been on your current insurance and have a little bit of a feeling for it. How does it typically cover you? What is its deductible? How much do your medications usually cost? And I'm going to use that as a point of comparison so that you have something to compare it to. We're going to talk about the pros and cons of original Medicare and Medicare Advantage plans. I wish I could tell you all day and every day that one option was just the best solution for everyone. Here's the deal. I don't even care if you don't work with me directly. If you want to work with anybody, a licensed agent, somebody your best friend, neighbor, or brother used, fine. But if you ever hear an agent utter the words, hey, I got a plan for you, it's the best plan out there, and they have not asked you about your medications, your doctors, your travel plans, any of that, that would be a huge red flag to me, okay? Medicare is not a one size fits all. I even have husbands and wives that go a different route and choose different plans. Why? Because they have very different health needs, okay? So it's very important that whoever you work with, that individual takes some time to get to know you and show you how what they're recommending is going to help to cover you. So we are going to ask about health needs and plans. Do you have proposed surgeries? Do you have a history of a medical issue? Anything like that? because there's some areas of this that future changes, they may not be able to be made. One of the things I hear a lot of times is, hey, Tiffany, I've heard if I go onto a Medicare Advantage plan that I can never get back to original Medicare. Okay, here's the deal. Medicare Advantage plans can be shopped out every fall to make a change to another Med Advantage plans. Similar to that, the drug plan you choose out of the gates can be shopped out and changed each year. Can you switch sides of the fence? If you start on original Medicare, have a drug plan, and whether or not you add that supplement, the answer is yes, I can always move over to the Advantage plan with no questions asked. Technically, if I want out of that Med Advantage plan, there's 2 different enrollment times a year. I can get out of it. I can go back to original Medicare and I'm guaranteed that drug plan as long as I do it during an enrollment period. What I'm not guaranteed is that Medicare supplement. Okay. The Medicare supplement only has 1 open enrollment in a lifetime. That's when you take out Part B. That open enrollment is a one and done. Once that window closes, you may have access to that supplement in the future, but now you're going to have to go through medical questions in order to get it. So it's not a guarantee. Okay. Again, all things we'll talk about during our one-on-one, so you really get to feel that. I absolutely need to talk to you about your premium budget and your out-of-pocket costs. I mean, I could sell you the Cadillac of all plans, but if you can't even afford to retire because I just placed your insurance out of your ballpark, then I didn't do my job. So we need to make sure that we're sticking within what you can afford reasonably so you can retire, and then what you're comfortable with in those out-of-pocket costs. Obviously, I have to look at availability and pricing in your zip code. Okay, I had an individual come into me the other day and he was really interested in an insurance company called Kaiser. Unfortunately, Kaiser does not sell in Nebraska, Iowa, Texas. They're more a Colorado out to California based company. If you don't live there, you don't have access to that insurance company. So we're going to look at actually what's relevant to you. And then, what are your travel and retirement plans? Are you going to live someplace 3 months of the year? Are you just planning to travel a lot, a little? Is there a possibility of a move? Then I'm going to educate you on how does that impact your insurance? What things can be changed? Okay. So we're going to get to know each other really well. All right. So now that we kind of have a big overview of what is A, let's talk about the options for signing up for A and or B. If you are drawing Social Security at 65 or before, you can either get it before because of disability, or some people even elect it to take it out at 62, which is the earliest. Typically, you can start drawing Social Security without a disability. If you're drawing Social Security, the government is going to assume something. They're going to assume you're retired. You're drawing retirement benefits, you must be retired. That means they're going to automatically enroll you in both A and B to start the first of the month that you turn 65. So I'm a July 20th birthday. If I was drawing Social Security already at 62, 63, whatever, the year I turn 65, July 1st, I would get my Medicare card that has A and B already on it and effective July 1st. Typically, they're going to mail that card to me somewhere between 2 and 4 months before I turn 65 so that I know I have it. But what if I don't want Part B? Maybe I'm retired, but my spouse is still actively working and on a group plan, and by default, I'm also covered under that group plan. Well, you have an option. If you don't want Part B, you can follow the instructions on the card, turn it back in, and decline Part B. What you can't decline is Part A. Once you're drawing Social Security, once that Part A is kicked into effect, there is no undo button on that Part A. Now, what if I'm not drawing Social Security? A lot of people are waiting till full retirement age or even 70, and they're going to wait to draw that Social Security. If that's what happens with you, then you have the choice of when you want to initiate that application for Parts A and or B. You get to initiate the enrollment, okay, by contacting your local Social Security office and setting up a phone appointment or submitting an online application. So let's talk a little bit about premiums. For Part A, most Medicare beneficiaries pay a $0 premium. I tell people it's not because it's free, it's because you earned it. Only people who paid 40 quarters or 10 years into Medicare taxes earn the right to have Part A for free. If for some reason you worked less than that or didn't pay into Medicare that long, okay, first option is you can borrow from illegal spouses. Okay, so maybe I had a spouse in the home that was the major worker, but I stayed at home with the kids. I am allowed to borrow from my spouse's hours. What if that doesn't apply to you? Maybe I haven't been working in the United States for 10 plus years and I'm not legally married to somebody who had been. Okay, you can still purchase Part A, but it's just going to depend on how long did you pay into those Medicare taxes. If you only paid 30 to 39 quarters, it would cost $278 per month. Anything less than that, you'd have to pay the government $505 per month. Now, if you don't buy Part A when you're first eligible at 65 and you don't have coverage through an employer, that's where a penalty would be involved. You would have to pay a 10% penalty per year that you delayed Part A. But for those of us who have put in our 10 years and earned this at a $0 premium, we don't have to worry about that penalty because 10%, 20%, 30% of zero is still zero. So Part A is not an area where you ever need to worry about being penalized, okay? It's just the timing of it is going to be important. Do you want it right when you're 65 so it can provide secondary hospital benefits to your group coverage? Or do you want to delay it for some reason? Okay, that's all things we talk about on our one-on-one. All right. You do need to have Part A at least in place in order to get a drug plan. So that is important to know. Okay, next slide. What about Part B? Remember, Part B can be delayed again if you have insurance through an employer of 20 plus employees. Typically, if you're not drawing Social Security, they're going to bill you for it quarterly. So every 3 months, they're going to send you a bill for 3 months worth of health insurance. If you're drawing Social Security, it's automatically deducted from those Social Security benefits. Part B premiums are based on your earnings. They look at what's called your modified adjusted gross income. Basically, it's lines 2A and 11 on a tax return. And it's always a 2 full year look back, not an average, but like in 2026, they're going to look at your 2024 tax return. Okay. So these premiums are for 2026. If you file an individual tax return, you're looking at this top column. If you file a joint tax return, you're looking at the middle column. And the bottom column is the correlating premium that you would pay based on that income. Now here, the number one question I get is, well, okay, Tiffany, but if I'm getting ready to retire, I may or may not be making in retirement what I did 2 years before I retired. So can that ever change? And the answer is yes. The government is going to continue to do a 2-year look back. So in 2027, they'll then look at 2025. In 2028, they're going to look at 2026. Whether you're new to Medicare or not, they're going to continue to do a 2-year look back at income. So very important that as you're working with a financial advisor or a tax accountant, anytime you're looking at taking amounts out of a 401k or a retirement account, that's taxable income, right? That could be factored into this modified adjusted gross income. I always try to help and advise on that so you don't throw yourself into a higher premium bracket 2 years down the line. All right, watching time. Enrollment periods for A and B. Okay, there are 3 different enrollment periods that apply. If and when you want to sign up for A and or B, here are the following times. First is your initial enrollment period. This is the 7-month window based around your 65th birthday. So again, we'll just use myself as an example. If I'm looking at July, my initial enrollment period starts in April. I've got April, May, June. Then I have the month of July, and then I have August, September, and October. If I apply for Medicare A or B during that 7-month window, right around when I turn 65, I don't have to answer any questions to the government. They're going to automatically accept my application and give me that coverage. Whether or not I had credible coverage, group insurance, employer-based coverage, does not matter. They're not asking, they're going to grant my application. However, if I turn 65 and I do not have an insurance through an employer, whether my own or a spouse's, and my insurance is not credible, then I have to wait and sign up for A and B during what's called a general enrollment period. This is January 1st through March 31st. Does mean I can apply for this coverage with no questions asked, and they're going to guarantee accept my application. However, for every 12 months I went without medical and hospital coverage, this is where the penalties would apply, and it would be 10% of the premium per year I went without that coverage. So if it was the medical coverage and I went 2 years without it, I got a 20% lifetime penalty on my Part B premium. Okay, we want to avoid this one. But the other one is green because it's also good. What if I had group insurance, again, through my own employment or my spouse's? Okay, well, then you are going to get what's called a special enrollment period. This is a window of time after losing or giving up that employer-based coverage that you would be allowed to get Part B in place, to get Part D in place. And remember, A, you can get whenever, as long as you put in your time for it. Okay. So these are the windows that I'm making sure we don't go too long so you're not incurring penalties. Ideally, I try to set all of this up so that you have the medical and the prescription drug coverage the day after you lose the group. So we also have no gaps in insurance. For Part D, very similar. You're going to have an initial enrollment period, that same 7 months around your birthday. You'll get a special enrollment period if and when you lose credible coverage through your employer. Okay, you get this little 63-day window that you can get it in place with no penalties. And then there is an annual enrollment period each year between October 15th and December 7th. These are for the rule breakers, the people who did not get prescription drug coverage right away or when they lost their group insurance. Then you can enroll in a plan for a January 1st start date. But again, this is the area where penalties would apply if you can't prove to them that you did have credible coverage leading up to this point. Okay. And that penalty again is 1% per month that you did not have coverage. All right, here's my pop quiz. If you have credible health insurance through an employer with 20 plus employees, which parts of Medicare can you delay without fear of penalty?
Okay, we've got responses coming in, but let's give people a minute. We've only got 6 responses so far, and it's kind of a little bit even at the moment.
Okay.
12 responses. We've got people selecting all the different
Options.
responses, but the majority have selected all of the above.
Okay, this is the time we're going to go with the majority in it. So it doesn't mean you were wrong if you chose one of the first 3, because that was right too. But really the answer is all of the above. If you have credible health insurance and the employer has 20 plus employees, I could technically delay A, B, and D drug coverage without any fear of penalty. Once I get off of my group plan, I'm just going to have to prove that I had it. Okay. So all of the above is the correct answer there. All right. Now, what I want to make sure you know is just because you can doesn't mean you should. So yes, you can delay all parts of Medicare if you're covered by the city of Lincoln on a credible coverage plan. Whether or not you should, that's a one-on-one consultation, right? That is looking at, well, who would cover you better? We're going to look at premiums, deductibles, out of pocket, your medications, and holistically, we're going to see who wins. Is it Medicare or is it your group plan? Okay. So these are ones that you can just type into the chat feature. Unless, did you make this a pop-up one? I think we can just do chat feature for this one.
Yeah, chat is good.
Perfect. In the chat feature, type away. We're going to start with the first one. At what age are you first eligible for Medicare, barring a disability or a chronic illness? Okay. At what age? Okay. All right, good, good, good. I'm seeing a lot of 65s. Perfect. And just as a quick reminder, you don't have to officially be 65. It's the first of the month you turn 65. That month will be your first day of eligibility. But as Kristen put in, you can apply. Oh, it's not quite 7 months before the 65th birthday, but you can apply up to 3 months in advance or 3 months after. So there's a 7-month eligibility window. Very, very good. All right. Even if I apply in advance of my birthday, though, it's always going to be the first of my month when I'm actually eligible or on Medicare. So just their clarification there. Oh, I didn't state this directly, but let's see if we picked up on the nuances. Do I have to start my Social Security benefits if I want to enroll in Medicare? Okay, I did talk about payments and options for payments. That's your hint. Okay. But do I have to start those retirement Social Security benefits to enroll in Medicare? I am seeing a lot of no's, a few yeses. The answer is actually no. You can completely go on to Medicare without applying for any aspect of your Social Security retirement. Okay, that's important to know because some people, again, are waiting until a full retirement age or until 70 to draw Social Security benefits. But maybe Medicare would be better health coverage for you than the employer's plan. You could enroll in Medicare and still delay Social Security. However, if I start Social Security benefits, retirement benefits, can I turn down all parts of Medicare? Okay. I want to start Social Security. Can I turn down all parts of Medicare? Good. I'm seeing a lot of no's, and I even had one person go the extra mile and say no, all but Part A. Okay. A is automatic. When you draw Social Security, the month you turn 65, A is going to be there. If you apply for Social Security after the age of 65, A is going to be enrolled. There is no way to undo A while drawing Social Security retirement. Okay, great. What happens if I keep working past 65? Here's the good news. And I'm not even, you can type in chat if you want to, but this is kind of an explanation. If you keep working past 65, you have options, and I love it. You're not forced to go on to Medicare, but you're not forced to stay on your group insurance. We can meet and actually see what's going to be best for you. And I'll see, do you have a spouse or children that are still on the plan that we've got to take into consideration? We're going to look at everything, but at least we have options. What I want to make sure is that you're making educated decisions about those options, not fear, not pressure, not penalties. Educated decisions. Okay. That's what's most important to me. What about if I go on to Medicare? What happens if my spouse is not yet eligible? Can they hop on Medicare with me? This one's an intuitive question. You'd have to kind of read behind the lines. If I'm eligible for Medicare and I go on to Medicare, what happens if my spouse is not yet eligible? Can they go on to Medicare too? Ooh, I got a brave person that answered. Oh, 2 brave people. Good. Ooh, good question on that one. Yes, the answer is no, they cannot go on to Medicare until they are eligible. So until they reach the age of 65 or until they're disabled for long enough or whatever. Medicare is very individualized. It takes each person as an individual for eligibility. So that spouse, if they were on your group insurance and you decided to leave the group insurance and go on to Medicare, your spouse would have to find other insurance options. Okay. Very good. Finally, and this one, Melissa might have to jump in on, but this was a question kind of specific to this group. Some of you have what's called PEP funds, okay? What I want to know is, do you know if PEP funds can be used towards Medicare and its related insurance premiums? If you have those PEP funds, can they be used towards Medicare and its related insurance premiums? Look at this educated group. I'm seeing it. I'm seeing yes, yes with an exclamation point. Heck yeah, an exclamation point. Okay, yes. You can use those PEP funds towards Medicare and its related insurance premiums, which is a huge, huge benefit, right? Wonderful. So again, what's my role in all of this? Okay. I'm going to help you to navigate Medicare. If there's an enrollment being recommended, I can oftentimes help you with the aspects of that enrollment, making sure that you file the right applications or contact the correct Social Security office. I am not Social Security. I don't work for the government, okay? But I do help you to navigate that in a timely manner and when you're supposed to. And then the rest of my job is helping you customize your insurance so that you choose the right path for you. You could choose original Medicare only, though I would not recommend it because you wouldn't have drug coverage and you would have no max out-of-pocket limit on your hospital and medical services. So you could also do original Medicare plus a Medicare supplement and a drug plan. You could choose a privatized Part C plan that works for you, your doctors, and your meds. There are other options we can look at, like do we need to add a dental, vision, hearing, a hospital indemnity plan that would help cover your hospitalizations, a critical illness policy that would help to protect you in the event of cancer, strokes, okay? If you have VA coverage or TRICARE, I can explain to you how that fits into the Medicare world and where it's allowed to cover and where it's allowed to help. Again, probably the most beautiful part of Medicare, once you're eligible, is it's the first time in your life you really get to customize your healthcare to fit your needs and your budget. I'm just your guide on the side, making sure you're making educated decisions to do those. Okay, hold on here. Hub, my company, has various resources to help you to do that because I am just one person and there's obviously a lot of people that get sent my way daily. So I'm going to tell you if you're 64 or younger, like on the really early side of 64, or you're 63 or younger, keep coming to these general information seminars, right? And 1 hour, I'm trying to educate you, but you're not going to pick up on everything. As you keep coming, more and more will stick. But once you're within 6 months of being 65, that's when you should really be reaching out for that one-on-one consultation. And your benefits department will always have my contact information. Okay. If I can't handle you, I do have a team. I've got an associate that works up in North Dakota, South Dakota, and Minnesota. And then I actually have a nationwide team called Berwick that can help me as needed with overflow. But the best time to reach out to us for that one-on-one consultation is within 6 months of actually turning 65 or within 6 months of thinking about your retirement. Then we can get on your or get you on our calendar and give you some timely, relevant information and quotes to help you make that decision. Okay. I know I'm running just a little over on time here, but your benefits departments will have contact flyers that they can send you where you can use a link to set up an appointment with me. It's got my phone number, my email for general questions. Okay. Oops, sorry. This is another thing within the PowerPoint, just has a link to my consultation booking, Erin Jansen's, my counterpart, and also the Berwick number if you ever needed to call them. Here's my email address. It is the L before the D. I am Tiffany Stalder, not Stadler. Okay, just so some things go to spam if they don't get sent to the right name, right? But if you allow me a couple of days to respond to you, I'd be happy to answer any general questions somebody might have. And then here are some of your upcoming lunch and learns.
Yes, I'll take this one. And Tiffany, I just want to ask, are you okay with us sharing this slide deck with the participants after the call?
Absolutely.
Okay, so
absolutely.
yes, Brenda will share that. Also, the recording will be available, and I'll make sure you all know where that's located. You can see on the screen the other different lunch and learns that we have coming up. I won't walk through all of these, but please know that you can find these and the registration links on our training calendar, which is on the learning page of the intranet. And then if you wouldn't mind going to the next slide, those of you who have joined us before, you know we're always looking for feedback. And so here's a QR code, but I'm also putting a link in chat so you can let us know your feedback about this session. And also if you have ideas of other topics that you'd like to hear on our HR Insights series, let us know there as well. I think we had maybe a few questions in chat that I'm not sure whether they were answered throughout the session, but we'll take a look at those and get responses from Tiffany and team, and we can send those out to you all as well, just to make sure that all the questions are answered. And then Melissa also said, please reach out to benefits too if you have any other questions. Tiffany or Melissa, anything else you'd like to add?
There was only one. I was kind of scrolling through the chat to see if there were any questions, and I did see one, and the attendant's still on. So, is it true the first time a person goes on to Medicare, everyone is accepted? That's a great question. So, that does have to do with those initial enrollment, but really the no medical questions asked, whether it's a Medicare supplement or a Medicare Advantage plan, yes, when you're new to Medicare, everyone is accepted into those plans with no medical questions. Okay. But also, what about those Plan Cs or those Part C Advantage plans? Is it true that if somebody wants to go back to original Medicare, I did talk about this a little bit, but just wanted to clarify, you can go back to original Medicare, but it's the Medicare supplement that if you're not new to Medicare anymore, they could ask you health questions and you may be denied. That's where that rumor comes from, is you may get stuck in an Advantage plan or a Part C plan. Okay, I think everything else, maybe I did get Part A being secondary to city coinsurance. We answered all that. So yeah, any other questions that come up, feel free to shoot those to me and I'll answer them. And then I will send the slide deck and all the contact flyers in an email that can then be distributed to attendees.
Perfect.
And March
Thank you.
11th at noon is when
Yep.
Tiffany will be here in person.
I'll be live and in person.
Wonderful. Thank you so much. This was amazing. This was such really good information. I appreciate it. And thanks everyone for hanging in here with us. That's it for us today. We appreciate you all. Bye-bye.
Take care. Bye.